One of the more common questions that we get asked, especially in my practice, is, do I need a lift? And it's amazing that a lot of patients don't really understand what a lift really is. Essentially, a lift is a procedure where the breast is changed so much, whether it's from pregnancy or whether it's from weight loss or some other changes, where the breast actually falls and droops. The correct anatomic landmark that we use to assess whether you need a lift or not is what we call the inframammary fold. The inframammary fold is that junction where the breast and the chest meets. If your breast tissue and your nipple and the areola falls somewhere below that inframammary fold, that breast no longer has the correct projection, in my opinion. And when that happens, that patient needs a lift. We need to bring the breast back up to a correct position on their chest. And sometimes we can do it without an implant. If you have plenty of volume of breast tissue and it's just sitting really, really low, I can do this surgery without even using an implant. But in most cases, we need to use an implant. The implant helps us give volume, but it also helps us lift the breast back up on the chest wall. But not every patient needs a lift. Again, that's part of my job to help the patient decide that. Sometimes patients don't understand, and sometimes they do, but my job is to make sure that they realize if they need a lift, and I think that's an important component of this, I will tell them that. In my practice, I work very hard at teaching my patients. I want them to know the scientific side of it, but also the artistic side of doing the breast augmentation. If a patient comes to me and says, I don't want a lift, and I think that they need a lift, that's a potential issue for that patient, because to me, it's important to do the right surgery. And sometimes the patients who don't want to lift, I tell them, don't do the surgery, because if I just take a breast that's pretty droopy and put an implant in that breast, it's just going to look like they have a big bump on their chest, rather than the breast being in the right place. There's an aesthetic component to what I do, and I have to restore that aesthetic. And if I can't restore the aesthetics, then I won't do the surgery for that patient.